Good afternoon, everyone. It is T-minus 14. That's how many more days left until my hip replacement surgery. Today, on my journey, I am headed to go get a x-ray. It's called a ball x-ray. Stop it, Terry. And I'm gonna get some blood work. Also doing my pre-admission testing. Well, that's what this is, pre-admission testing. Make sure that I am capable of undergoing the surgery and filling out all the paperwork beforehand that needs to be done. So I'm inviting you. Come along. Back home. Took probably about 2.5, 3 hours to do. Stopped and got me some lunch, which I'm gonna eat here in a little bit, some Taco Bell. Anyway, they had me fill out a bunch of paperwork. They gave me a big pamphlet of stuff. They gave me some soap to shower with the night before and the day of, to get myself clean. Took some blood, and the lady didn't do that great of a job. Let's see there. Can you see the bruise? You know, I got some pretty juicy veins, and she did a pretty good job of bruising me up. So, I don't know. What else? Had to pee in a little cup. So, as long as the tests come back good, then I'm ready to go. T-minus 7 days and counting. I am headed out this morning. I'm gonna go to one of the theme parks here in town. Probably be my last outing before the surgery. I had to fill out some information and submit it online. As far as medication goes, so what else? They moved the day by 1 day, moved it back 1 day, had to adjust my medication that I take so that it doesn't interfere with the anesthesia and anything else that I'm taking. They submitted my prescriptions to the pharmacy. I have picked those up. The medications, there's several. I couldn't begin to tell you. Most of them had to do with pain. Pain from the surgery, nerve pain, from what I understand, is no joke. I picked those up, and all the medications, and forgive me, I don't have an exact count as far as how many they were. With my insurance, cost me like $6. So I was very happy about that. I got a call from the facility where the procedure is going to happen, and they told me that my out-of-pocket was going to be, and I'm rounding up a bit, $6,700, $6,700, and payment is due upon check-in, which is okay. Debbie and I have planned for that, and I'm gonna use our Disney Rewards card for it and pay it off after the procedure's done. So we'll get Disney bucks or Disney points towards the Disney vacation for using it for this hip replacement. So I guess that's a silver lining. I think it probably is a silver lining. That's where we are, and I'm starting to get a little anxious about it. Trying not to think about it too much, because it'll really crank up the anxiety. But that's it. I'll update more later. Good morning. It is T-minus 23 hours until check-in for my surgery. I got a call a couple days ago telling me, hey, we need you at the facility at 8 a.m. I'm like, great. You want to do this, this, and this? Great. Any questions? I had a couple questions to do with my medications, and they answered those questions for me. So, yeah, tomorrow's the day I become Wolverine or the Winter Soldier. Probably a little bit more accurate because, you know, I'm just getting hip replacement. I don't know what they make it out of. Probably like titanium or something. I don't know. Probably some expensive space age metal. Who knows? Maybe they 3D print it right there and then and there. They take it out, scan it, 3D print it. Boom. There we go. That'd be interesting. Yeah. Carrie has come into town. She's going to help Debbie out. Well, she had kind of like a happy accident. She came into town for some work-related stuff. So she's like, hey, I'll just stay a little bit longer and I can help you take care of the demanding uncle and, you know, help you out over the weekend. So I think Carrie's going to drive us tomorrow because she has the minivan. It might be easier for me to get in and out of after the surgery if I leave the facility tomorrow. That's always a question as far as how I handle the anesthesia. So I'm planning on filming a little bit tomorrow on the way there. Do like a van talk and let you know how I'm feeling. Right now I'm gonna go get breakfast. Good morning. It's T-minus, we'll say 20 minutes. I don't see a clock, so I don't know what time it is.
7:47.
Okay, T-minus 20 minutes for arrival to get the hip taken care of. A little anxious, but I don't have to drive in the traffic this morning because Carrie's driving. We're in her minivan and there's Deb in the back. She's like, oh God, I gotta take care of this guy for like the next few weeks.
Yeah, super excited.
She's very thrilled about it. So, yay. I'm just thinking about good thoughts and being able to walk and not be in pain. Getting real. So, got my party hat on. Warm blankets. Robe that buttons up in the back. It's getting real. I wouldn't mind a big old iced tea and a potato and egg taco.
Christopher, go for
Post-op, I'm out of surgery. Painful, of course. They tell me everything went well. I'm spending the night. And so far I feel good. Other than the pain and the fact that someone cut up with my leg. And they've given me some pain meds and probably get some more here in a few hours. So we're good. Do you like this sexy look with the shoulders showing? Look at that. Yeah, that was scandalous back in the 30s, right? Showing skin.
Alright, so the walker is just there to help you walk. It's not meant to do the walking for you. So just move it and walk with it.
Okay, doesn't matter what.
We'll leave with your surgical leg first.
Here we go.
Papa's first steps. You're all covered up, you look fantastic. Let's get out and check some sights and sounds, Agent.
Such as
Yes, it says they are.
We're moving.
No big steps or anything like that.
No,
Just
it's-
whatever I feel comfortable with.
Exactly. Don't take any bigger steps than
Got my first meal of the day. We got steak fingers, potatoes, some corn on the cob. I mean, that's not the street corn that I love, but you know, it'll work. And they got me some type of strawberry shortcake. Nice. Now if I can only
Something
keep...
else. What's in the little cup? Or was that already there?
That was already there. That was the apple juice. Now if I can only get Debbie not to eat in it.
I think you're good.
Okay. So this is probably 24 hours after my surgery.
Not quite.
Oh,
About 22.
There's Deb and Carrie.
About 22 hours after your surgery.
And I'm gonna get to go home. I already showed you what I had for breakfast, but I was hungry, so it disappeared rather quickly. It was a ham and cheese omelet, hash brown, and slice of toast. Cut in a triangle. It tastes better when it's cut in a triangle. No, it was cut in a triangle. It just tastes better when it's cut in a triangle.
Oh, okay.
So my surgeon, Dr. Phelps, came in. Didn't recognize him at first because he looked like Billy Joe Bob Redneck.
Does anybody know who Joe Bob Redneck is?
But he, good surgeon, you know, took care of me and all that stuff. So the internist, he took care of me also. He's like, you look good. It's like you can either stick around till 11:30 and have lunch, or we can start the process now. I'm like, home please, thank you. So we've been contacted by Home Health, so I'll be having somebody helping me, what do they call that? PT, what's PT short for? Physical therapy, there we go. I'll be having physical therapy at home, and it's gonna start Monday, so yeah, on the way to recovery. When you can't see anything as far as the scar goes because it's covered up by this big old Band-Aid. So, oh, that's the other thing. The doctor said that there's no sutures to take out. It's all done. So I might have minimum scarring, if at all. So I'll be able to wear my my bikini bottoms at the beach. Oh yeah.
Perfect. Well, you're steamrolling right now. This looks pretty good. Okay, so now take your time. We're gonna turn around. So try to turn to your left for me.
That's what's
Yes, sir.
Yes.
There you go. Perfect. So now, healthy leg is gonna propel you up the step. Boom.
I think I cheated on that. Maybe too much on my weight.
This looks pretty good. Man, going up the stairs is no problem for you. Going down the stairs tends to be a little bit tougher. That eccentric motion is one of the hardest kind of contractions the body kind of does.
I made it home. Yes. Tomorrow I get to meet with a nurse for evaluation, and then on Monday, well, tomorrow's Saturday, so on Monday, I guess you didn't really need to know that. So on Monday, I'll have my first home health visit from the nurse practitioner and physical therapist or something to that effect. I'm sure I'll be cussing her the entire time. 3 days post-op, right?
Yes.
3 days post-op. In my comfy house, in the comfy chair, which is Debbie's side of the couch. I kicked her out of it because it's easier for me to get in and out of it. It's more comfortable than my side, not all flattened out. Anywho, as Terry would say, I had a Zoom call with a caregiver yesterday to qualify me for home health. And then I have home health on the way over here for the first time this morning. They're going to check out the bandage, make sure it looks okay. They're going to probably check out my mobility and give me some exercises and stuff they want me to do to strengthen up my hip. Oh, and I have this little device here to check out my lung capacity. I forgot about it yesterday, but basically what I do is I inhale from the tube. I have to use my words carefully there. I inhale on this tube and cause it to go up to where that green little bubble is there to help make sure that my lungs are fully oxygenating my blood and everything is going well. I don't have to do that too often. I think they said like maybe twice a day, if that. I did it like every hour while I was in the hospital, and now it's like on occasion. Okay, let's see how physical therapy goes.
There's my fashion statement. Get in the mail. Not bad for day 5. Why the pants legs had to be pulled up, I'm not really sure, but hey.
Don't I look sexy with my hair just sticking straight up, you know? Put product on there, it just doesn't help them all. Day 8, post off. I'm going to walk across the street to get the mail. I know, it's exciting vlogging stuff, watching me walk across the street to get the mail, but considering I have a walker and my left leg's about twice the size it normally is because of swelling, which I have to say I'm a little concerned about the amount of swelling because it just continues to go lower and lower down the leg. So I don't know. Anyway, so let's go get the mail. It is day 14 post-op. I think I've had 5 visits from the physical therapist, and everyone seems to think that I'm doing well. They say I'm doing well. Still have some pain. Pain threshold is not that high, depending on the day of the hour of the day. Right now, it's not too bad at all. Trying to transition from the walker to using the cane. He wants me to use the cane inside the house, and then when I go outside to use the walker. So I'm still taking little walks. I'm walking in the mailbox and back. I'm taking a long way around, so you see that footage. It's doing okay, you know. It's hard to judge my mobility at this point because I'm very, very stiff in that leg. There's some swelling around the knee, so it's very difficult to kind of bend at the knee. But I'm getting there, and continue to do my therapy every day to try to get more flexible and continue my progression as to walking without any assistance. So I guess I should be happy, you know, 14 days or 2 weeks, and I'm back to a cane. So let's see how the next 2 weeks go, and hopefully, well. Monday, I have a, what do you call it? FaceTime with the doctor, Dr. Phelps. We're gonna go over my recovery, probably look at the wound, might even get the bandage off that day and, you know, be able to see how that looks. Make sure that there's no things that I have to be concerned about. There hasn't been any oozing or discoloration or anything like that, so everything looks like it's fine that I've been able to tell. Debbie says the bruising towards the back of my hip has gone away, but there's still some swelling around
the thigh area, and still some discomfort, but nothing that's not tolerable or manageable with pain meds or even with just some Tylenol. So definitely a different pain than what I've had in the past with walking. With each step was an exhilarating experience, I guess is a good way of putting it. But yeah, that there's been different kind of pain, but I seem to be doing well. I am out at a Target with Debbie doing some grocery shopping on a cart. Vroom, vroom. Day 18 post-op. I just got off the phone with the Dr. Phelps physician assistant. We go over the wound management, I guess is the best way of putting it. And they seem to be happy with my results so far. They wanted me to go ahead and pull the bandage off. So I did that. Not gonna be much of a scar. Let me see if I can get this on video without getting it on video, you know what I mean? So let's see. So there's my incision. Now this is probably more of me than what you wanted to see. They say it's healing pretty good. Seems to be healing pretty good. And they told me not to put a bandage on it, just let it kind of like air out. But if I see any type of like separation or anything like that, you know, to give them a call, let them know. I had a scheduled appointment for 4 weeks out at the doctor's office so they can take a look at it. They'll do some x-rays, and I think it's going to be okay. Just a matter of continuing therapy, taking it easy, and not trying to be Superman or anything. No hot tubs or swimming pools. So, yay. So I think I'm going to wrap up this series of vlogs for the hip replacement. I talked to the I had the physical therapist evaluator come over and said, yeah, your progress is going pretty well, just keep on doing it. Probably going to switch me to an outpatient, so I'll start going to do exercise at a facility. I talked to the physician's assistant for Dr. Phelps's office, and they had me remove the bandage and said everything looks well. We'll just continue to monitor it to make sure that you know, it doesn't get infected, and everything was looking good. They had me schedule a follow-up 4 weeks out from today. They'll probably get to me within the next 48 hours to schedule some therapy at their facility. So that'll be ongoing. They said it'd take up to 6 months to a year till I'm like 100%. But you know, I think I'm moving along pretty well. I'm mobile. The pain is manageable. So I think everything's headed in the right direction, so to speak, which is forward. So I have you know, a few more weeks off of work for rest and recovery, and then I got to get back to the grind of that, and we'll be getting out to the parks hopefully a little bit more. Maybe be able to ride some stuff coming up in June. Fingers crossed. Let's see what happens. So thanks for coming along this journey. If you have any questions, you know, leave them in the comments down below. If you want to help with the recovery process as far as helping with the financial end of it, I do have a Buy Me a Coffee. Link will be in the description. All in all, I think, you know, it's been a successful and a good journey for me so far. So if you see me around the parks and you want to ask a question about it, hey, go ahead, ask the question about the hip, and we'll go from there, okay? Anyway, thanks again for watching, and now for something completely different. Bye. Always the case.